Good evening. Welcome to Cook County Health. I'm Elizabeth Peterson, and I'll be your host for this evening. Tonight, our guest is Dr. Nimmi Rajagopal, Associate Chair of Family and Community Medicine. Welcome, Dr. Rajagopal.
Thank you for having me.
Before we get started, I want to remind our audience that if you have a medical question or need help with a healthcare-related matter or need a provider, please call our helpline at 312-864-0200. Again, that number is 312-860-0200. Welcome back. Dr. Rajagopal, as you know, January is quite the month of New Year's resolutions. Tell us a little bit about what you do at Cook County Health before we get started on talking about New Year's resolutions.
Right. So I'm fairly new to Cook County. I just joined 4 months ago, and I am the Associate Chair of the Department of Family and Community Medicine. And so in this role, I have a really great opportunity to kind of be behind the scenes and work on the administrative perspective in terms of how we can kind of mold the system to be able to offer greater services to our patients and also make our employees want to work there. So we have a lot of people doing great things at 10 different sites across the county. And there's a lot that has to go on behind the scenes for that. So to make that happen and to make it a place that people really want to work and do the great things that they're doing out in the community takes a lot. So it's kind of cool to see how things are behind the scenes. In addition to that, I really get to work in clinic and see patients out in the Austin neighborhood. And then I also supervise residents at our other sites, which are Jorge Prieto in Little Village, near South, and also in Englewood sometimes. So it's kind of cool to actually get to work in a bunch of different neighborhoods. Chicago is just so rich in cultural diversity, and to be able to be out there in the neighborhoods and really see how different healthcare needs are in different neighborhoods is great from the perspective of also seeing, like, what do we need to do with those clinics to make our services better there.
So how did you get interested in your line of work, family and community medicine?
So I, way back when I was a resident, I worked in a community health center in Jackson Park, and I got to see what family practice does and family medicine does, and it's this opportunity to take care of patients through their whole lifespan, which is literally from womb to tomb, as we say. And so it's really cool. I used to actually go in and get to do deliveries, and I do prenatal care in the office, but I get to take care of patients throughout their lifespan, and then I get to take care of families. So it's so fun to be able to take care of a mom and her child when they come in together. I've only been here for 4 months, but where I was before, I had multiple generations of families that were coming in to see me. And it's so great just to know the family on top of just knowing their healthcare needs. So just an amazing perspective and such a great privilege to take care of a whole family.
Yeah, no, excellent. Well, thanks for sharing a little bit about your background. Like I said, January is the month that everyone becomes, holidays are over, now it's time for New Year's resolutions. So tell us what some of your patients have as their common New Year's resolutions.
So the resolutions are pretty common in general. It's, I want to be healthier, I want to exercise more, I want to change my diet, I want to quit smoking, I want to quit drinking. Those are the most common things. So most are really around lifestyle changes. People feel like they should be doing better, and so they're going to start the year with a bang and make these changes.
Gotcha. So a lot of patients have trouble sticking to them. I know from my past experience, I have had trouble sticking to my New Year's resolutions. How do you advise your patients to stick to their New Year's resolutions?
Yeah, it's really hard. And what patients do is we tend, not just patients, but all of us, what we tend to do is to approach a resolution kind of like the hare in the tortoise analogy. So we're going to go with a big bang. We're going to jump right into it. We're going to just take it head on, and then we exhaust our resources, and we get burned out, and we fizzle off of doing the things that we wanted to do, or we said we were going to do this resolution. And so I really try to encourage patients to kind of take the slow and steady approach to get through this. So rather than making this big change, like I'm going to lose 50 pounds in a month, and I'm going to just change, I'm going to cut out all the pop and all the junk food, and I'm just going to be healthy, is let's take small steps. So we may want to lose 50 pounds, but let's create a more realistic goal. So I try to really help patients with that goal, and then also to create times that we can check in on along the way, because we know that sometimes we can stop being held accountable when it's just us, right? Like, I can fall off and then I can give it up. But if I have to be held accountable to someone or check in with someone, I'm more likely sometimes to actually hold myself to it.
Excellent. That's good advice. I know as far as dieting fads, there's a lot out there. There's keto, there's South Beach, Atkins. I mean, there's Mediterranean diets. There's a lot out there. How do you tell your patients what type of diet to pick? Because, there's so many, and how do they know what's right for them?
Yeah. So first and foremost, any patients that are on medications, any patients that have chronic medical problems, I really want them to talk to their physician or talk to a nutritionist as they're trying to decide which diet to follow, because some things are not good. So for example, if someone's a diabetic, we want to watch what kind of carbs they have and things like that. So if they have any chronic medical problems, really something we want them to make a decision with their physician or nutritionist. If they don't, part of it is finding the balance. Fad diets are really hard to maintain. So when you say, like, I'm going to cut everything out of my, I'm going to cut out all carbs. Well, if you really like pasta, that's hard. So I really encourage patients to kind of steer away from the fad diet, but let's look at your diet on a daily basis and say, what are the things that are like your weakness, and then how do we temper that in? So I never tell a patient to cut everything out because it's just not realistic. So even diabetics, like, we have to find healthy treats or healthy snacks that you can take, but that might curb your sweet tooth.
Okay, that's good to know. Good to know. Obviously, also out of diets come supplement use, and patients are often worried whether their supplements are going to counteract medications if they take prescription medications. So what do you tell patients as far as taking supplements? And there's also been new literature out about, are these supplements even worth it to take? Do you need to take these multivitamins? What do you typically advise patients on?
So typically I tell patients that if you're eating a pretty healthy, well-balanced diet, you don't need to take a daily supplement. Now, some people have a pretty rigid diet, or they might be vegan or vegetarian, and so they might be lacking some things, and they might need to measure their blood count and see if we need supplements or not. One of the things we have to remember about supplements is, one, there's a lot of supplements out there. So I myself don't even know all the supplements and what the possible side effects are. Also, supplements aren't regulated the same way medications are. And then they can interact with your medications. So again, anyone on medications, the best thing to do is bring the supplement in or talk about the supplement beforehand, before they start taking it, because we don't want to take any chance of it inactivating a medication they're taking or an interaction. Everything we take, medication supplements, have to be broken down. And so we want to take that into consideration. So again, talking to their physician, talking to a pharmacist sometimes can be very valuable as well, or a nutritionist, to look at those interactions before they start them. But typically, we can try to manage things with balancing our diet and not necessarily need a supplement. So I encourage patients to try the diet first. And then, of course, we look at, some supplements are good for certain things. Like, we know that vitamin D can sometimes help with people that are having some mood issues or feeling depressed. It can help perk them up a little bit sometimes. And there's some other things, St. John's wort, there's some things that can help with postmenopausal symptoms. So things, again, to talk with their doctor or a pharmacist or a nutritionist is really valuable.
Okay, excellent. So now that we've talked about diet and exercise, let's talk about exercising. That's always a big thing for patients as well, especially people working. It's hard to find the time to exercise. So how do you tell patients, you have your diet down, you have supplements, how can you best exercise, and to what frequency? And obviously different ages. If you're elderly, maybe have some restrictions. Tell us what you tell your patients.
Sure. So one of the things is that we tend to approach things like changes in our exercise routine as an all or nothing. So we go into it saying, the recommendation is 30 to 60 minutes of exercise that raises your heart rate most days of the week. But that's a pretty lofty goal. Okay. So I tell patients that if you go from not exercising to exercising 10 minutes 2 days a week, that's a big step. So we take it in increments. So if our goal is 30 minutes most days of the week, let's start with, can you walk for 10 minutes twice a week? Do you have a safe place to walk, of course, first, but
Right.
can you go walk for 10 minutes? Or, what's kind of cool is that most cable services actually have free exercise things on their on-demand. So, and at different levels. So a lot of them have like free yoga. There are channels that have like chair exercises. So for elderly patients that we don't want to get up and moving a lot, but we want them moving, they can do chair exercises, and a lot of this stuff can be done for free. People don't go to the library quite as much, but libraries still have DVDs of free exercise videos and things. And then YouTube has a ton of channels. Now, the only thing I would warn about YouTube channels is, again, there's some channels that are kind of more reputable. And so reviewing that with your doctor beforehand if you have any health problems or particularly if you have any musculoskeletal joint problems. But so every little bit counts. So it doesn't have to be the all or nothing. The other thing that's huge is there has to be an element of self-forgiveness anytime we're making a lifestyle change with this. So when we skip a day, this was supposed to be my day to exercise, or, I have my Fitbit and I was supposed to get 10,000 steps and I only got 4,000 today. It's okay. We start again tomorrow. The Fitbit starts counting again at midnight. So if we didn't make our goal today, it's okay. But we have to give ourselves a little leeway there and know that we can't make the change all at once. There are very few people that can, at the snap of a finger say, okay, I'm going to just go to exercising every day and it's going to work in my routine. So we have to give ourselves that leeway, and we have to be self-forgiving, and it's not an all or nothing. And that's a really, really hard thing for people to accept, is they think that I made this commitment, and if I don't do it, then it's really easy to just fall off. Oh, you know what? I ate McDonald's yesterday, so I'm done. I'm done for I ate McDonald's yesterday or for lunch, so you know what? It doesn't matter if I drink pop for dinner.
Right.
But every little bit counts, and I think that's the important thing to realize.
You mentioned something about Fitbits, and we have the Apple Watch now and our smartphones. Do you think that's actually helped people be more accountable? Do you advise your patients to use that as an assistance? I'm kind of old school, so I don't have an Apple Watch, but I'm just kind of interested to see, what you found through your patients, if they found that helpful or not.
Yeah, I think it very much depends on the person's personality. So it depends. Like people that have kind of a competitive streak, getting those steps in every day, or getting the points, or competing with each other on, Fitbit and things, that's really important. If that's a driving factor, then that's really good. For some people, it doesn't change anything. So my mom, for example, she's phenomenal, but she is dead set on getting her steps every day. So if she doesn't get her steps, during the warm weather, she's out and about, but if she doesn't get her steps at night, she watches TV and she walks around the room until she gets her steps. So that's a really good motivating factor for her. But it just depends on the person, because it's also an investment, right? So a lot of people can't afford to do that. The other, though, is most of our phones now actually count steps, and most people don't know that. But most of our phones actually have apps on them that can count the steps. It's not as accurate as a Fitbit, but if that's a motivating factor for them, then that's great.
Interesting. Well, that's good to know. As far as, obviously, they say about 8% of people stick to their New Year's resolutions. So what happens if you actually fall off the bandwagon? How do you advise patients to get back on track? They're probably lacking motivation, and just that, they're never going to lose that 10 pounds or 15 pounds or whatever it may be. How do you get patients to say, no, I can do a part 2. It's okay.
Yeah. And I think again, it goes back to that we set these really lofty goals, and we're not always realistic in how we set them. So as a patient setting a goal, I want them to try and do something realistic, and then also talk about that aspect of self-forgiveness, and that if you fall off one day, it's okay, you get back on the next day. We didn't get to this point for most people overnight. We're not going to suddenly change everything overnight either. And I think that acceptance is really important. So I encourage patients to take kind of a stepwise approach. So if our goal is to lose 50 pounds, okay, let's start with the first 10 pounds. And how do we make those changes? And if it doesn't happen right within the time frame that we set, that's okay. But there are a couple things we know help us to achieve and get back on track. So one, writing the goals down as opposed to just verbalizing them, it's actually been proven that people that write them down are actually more likely to achieve their goals. Writing goals down, having a support system. And so a physician or a provider, their primary care provider, is part of that support system, so the check-in on the regular basis, but there are other factors. So if I can get a family to make the changes as opposed to one person in a household, that's huge, right? Because if you're the only person in the household that's trying to quit smoking and you're surrounded by smokers, that's just an added challenge, right? But again, teaching them that self-forgiveness and that it's not an all or nothing. This is the marathon, it's the long haul. So one day at a time.
Excellent, excellent. So, as mental health becomes more of an issue today, people are definitely more comfortable about it. Do you have people coming to you and saying, I really want to work on my mental health and just behavioral, versus diet and exercise? Is that becoming a thing today as, that's becoming more a societal thing of talking about mental health?
Right. I would love for that to be the case. I would actually love to have someone come in and say, I just feel like I need to work on my mental health. It's not the case most of the time. Most of the time people are coming in when they've become overwhelmed, when they've become overstressed, or they might be starting to feel depressed. It's great that mental health is out there more, so people are more open to services. There are a lot of cultural biases about getting therapy and things like that, and so we're still at a point where most people wait until they actually need to have some additional support. But I also think from our perspective, in the medical field, we've worked on starting to screen for when people are at that point. But one of the really cool things that's built into our electronic medical record is there's actually a section for self-management goals. And so we can actually ask patient, what are the things you want to focus on? And so we can start bringing up mental health goals and stress relief in that aspect. So a lot of times a patient may not come to you and say, I'm really stressed out. But when you just talk to them about their lifestyle and what's going on, like, if they're a single parent and they're balancing their job and taking care of a child, and then we ask, what's going on, or, how are you handling your stress, and talk to them about it. But we haven't gotten to a point yet where patients are coming to us for that reason, or just asking and saying, life's pretty stressful. What are some things I can do? We'd love to get there, and I think we'll get there eventually, but we're just not there yet.
Right. So do we have, behavioral specialists that work out in the clinic then, alongside the primary care physicians?
Yeah, that's a great question. So one of the really cool things that we have, I think now at all of our sites, is that we have both a medical social worker and a behavioral social worker.
Oh, excellent.
So medical social workers can help with things like getting a blood pressure machine for a patient. A lot of insurance companies actually will cover a blood pressure machine for a patient that has had blood pressure. So they can help with that and to get it covered through the insurance so the patient can start monitoring at home. And then we have the behavioral social workers to offer therapy services and help as well.
Okay, excellent. In addition to, obviously, we've talked about diet, exercise, supplements, drinking and probably quitting smoking are still some of the top New Year's resolutions as well. What approach do you take to have your patients kick these habits, especially since vaping has been used by a lot of previous smokers to try to quit? That's obviously controversial now that there's been a lot of health problems around vaping. Tell us a little bit more about that.
So quitting smoking, quitting drinking are obviously two big things that people try to do. And again, most people approach it with an all or nothing approach. And if a patient's ready for that, that's great. And we have resources. But medicine's changed a lot. Like back in the day, you went into the doctor told you what to do. The doctor told you just quit smoking, right? You gotta quit smoking. I have these things to help you smoking. It's bad for you. Yeah, but we just tell patients. It's changed a lot in that we realize that doesn't work. We have to meet the patient where they're at and when they're ready. So it's about figuring out what the goal is. And often the goal isn't, I'm going to quit smoking, but what can we do? Can we cut back on 2 cigarettes a day? Can we cut back from a pack to 10 cigarettes or half a pack? And what can we do in that realm? And again, going in that stepwise approach. In terms of vaping, as you know, there have been a lot of illnesses specifically related to it. It's kind of been substituting one chemical form for another. And I think part of the factor in it is the way that it's being delivered to the lung. There's been a lot of illnesses. So again, not encouraging vaping, but encouraging can a patient cut down and talking about the options that we have to help a patient go through it.
Gotcha.
Yeah.
So do you tell your patients then if they're trying to quit smoking that they should not use vaping then?
Yeah, I don't encourage vaping as an option. I talk about, especially people that have been smoking for a long time, what can we do to start cutting down, and then talking to them about the options and the support. There's some great support options here. There's the Illinois Quit Line to help patients that they can call when they're trying to quit, and they can call if they're having the craving, and somebody will talk them through it. And then there's medications that can help as well, and those have been studied in a little more detail, and they help to wean a patient off the nicotine. And then that other mental health aspect of it is often we use that as a coping mechanism, right? So addressing what are some other healthy options for handling stress.
Excellent. So now that we've kind of talked about everyone else's New Year's resolutions, Doctor, do you have any New Year's resolutions that you want to share with our audience?
So, I have the same struggles, the eating healthy, the getting exercise in, and I'm having a big issue with the self-forgiveness part. I have a hard time with when I fall off, getting back on it. So I go through the same struggles that my patients are going through, and, trying to find that time to fit in exercise. I know it's better for me stress-wise. I know that on the days that I exercise, I feel better. So really working on that self-forgiveness aspect and trying to get it in as many days as I can and working forward from there. But yeah, it's, I do share that I have the same struggles with my patients because I think we're all human, and our patients need to know that they're not the only ones going through this, right?
Yeah.
That we can commiserate with them. So
Well, you're a patient yourself, right?
exactly.
So is there anything else you want to tell our audience before we sign off for the evening?
Yeah, I think that partner in doing this is a really important thing. So if you're trying to make a lifestyle change, you have a friend that's doing it, and that you guys can kind of help yourself to motivate each other, that can be very helpful. Partnering with your healthcare team can be very helpful. That regular check-in does actually make a difference. We don't think it will, but if you know that you're seeing the doctor in a few weeks, you tend to kind of stay on track a little more. You know that you're going to be kind of checking in or reporting out. It helps us to stay motivated. But doing it alone is hard. And then, like I said, it's baby steps. And there's something called SMART goals, which we don't need to go through, but making a specific goal, a measurable goal, something that you can achieve realistically, and that is kind of in a realistic time frame. So we don't want to make goals that are outside of our reach.
Okay, excellent. So that concludes our session for the night, but thank you for joining us. Again, if you have a medical question or are looking for a provider, please call our Patient Support Center at 312-864-0200. Again, that number is 312-864-0200. Thanks again for joining us tonight, and thank you to Dr. Rajagopal for joining us. And remember, make your goals achievable and write them down, and grab a friend, and if you fall off the wagon, get back up again. Good night.